Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Tuesday, July 7th. We'll begin with COVID as we normally do, and then we'll jump into some non-COVID topics, which is great.
That's right.
First graph is the 8 counties of the capital region. You see this continues to be a great story. The number of people currently in hospital beds in those 8 counties, Fred, 24.
Yeah.
So it continues to be a very low number.
Yep.
Next graph is activity here in the medical center, admissions and discharges. Again, like we spoke about last week, now we're seeing days where there's no activity, no new cases coming in the hospital, and so the number continues to go down. So let's pop up the third graph, and this is the morning census at Albany Medical Center of people with COVID-19. Fred, today, 14 people, all on the floor, none in the ICU, so obviously none on the ventilator.
That's right.
And if you look at that other number, which is the number when you back out those that are not being treated, we have less than 10 that are actively being treated for COVID.
That's right. Again, the lowest that we've seen.
So credit to the people of the capital region. They're doing a great job keeping the virus at bay.
They are.
Which is great news. Speaking of COVID, now let's jump in. We did this a couple weeks ago, since we only now talk twice a week. Fred, I'm going to go through like 7 or 8 items, and we'll give a quick update on the status of a bunch of things.
Okay.
Let's start with activity in the hospital. We know that when COVID was at its highest mark in the hospital, our hospital census was at its lowest number. People were staying away from the hospital.
That's right.
So give us an update. What is it like in the hospital today from a hospital census standpoint?
So Dennis, that low number at sort of the nadir was 425.
Right.
Today we started at 6 a.m. with 714 in the hospital.
Right.
So we have 748 beds in the hospital, so we're really pretty full.
Right.
In the ICUs, in the pediatric area, the NICU in particular, very full, and the ED had a very busy day in the last 24 hours.
So it's definitely looking like it was pre-COVID. Let's talk
kind of back to normal in that regard.
Let's talk about the operating rooms and surgeries.
So Dennis, surgeries, same thing. The last couple of weeks, basically, we're at our budgeted number of surgical cases. We've had high 90s for the main OR, 98, 96 cases in a day, which is a very busy day for our main ORs.
For sure. And now we know what the activity in the outpatient setting and the practice looks like in the month of June. How did we compare to how we might have expected to be?
So my understanding, Dennis, from a budget to actual perspective, we were at 97% of our budgeted number, which is terrific. Absolutely terrific.
All those things to me suggest that people now believe, as they should, that it is safe to come back on campus and seek medical care.
And Dennis, it is safe to come back to the medical center. We're doing all the right things, and even as importantly, the community's doing the right things.
Yes.
So the spread is not out in the community.
That's fantastic. Speaking of community, we now know that we as a capital region entered stage 4. So certain things opened up that were not open in stage 3. There's a couple other things that are still yet to be opened up. How has stage 4 impacted us on this campus?
Again, Dennis, just like stage 3, no difference.
No change.
No change at all for us.
Okay. There is a change, however, I believe, is as far as the states to which travel now will require quarantine when you come back. The governor announced a new list.
Just today, he added 3 more states to that restricted list: Delaware, Oklahoma, and Kansas.
Kansas, okay.
Yes.
So our screening process when you come in now will include that. And
first question is, have you traveled out of state? And if the answer is yes, then we go through and see if you've traveled to any of these restricted states.
All right. Speaking of visitors when they come on campus being asked that question, is there any update on what it means to come and be a visitor at Albany Medical Center?
So we're still functioning the same way the last time we talked about this. So 4 hours of visitation for inpatients, 4 p.m. to 8 p.m.
Okay.
Over the holiday weekend, we averaged about 230 visitors a day. Actually, yesterday was very busy. We're over 300.
I think that's the first time we may have been, or one of the first times we've been over 300.
Actually, I think it is the first time we've been over 300.
Okay.
So gradually increasing numbers of visitors to patients.
So visitors are increasing on campus. What about vendors, people who come in and provide services on the campus? Are they allowed back in?
So Dennis, we're taking that almost on a case-by-case basis.
Yes.
So we are allowing some vendors back in. Some of them are doing some vital repair work on equipment, those kinds of things. But we're being very careful, and it's a case-by-case decision.
Okay. We mentioned July is often the beginning of the new academic year. So in our medical school, we have 4 years. Our third and fourth year students are now doing their clinical rotations on the floors. The first years are due to start, I think, soon, but they're not here yet.
They're not here yet. I think they come in August.
And remind us, how will we handle them when they come on campus from the standpoint of COVID?
So they will be, in essence, quarantined for 14 days. They'll wear masks for 14 days because they come from, really all around the country. And they'll be temperature and symptom monitored for those 14 days.
All right. And you mentioned masks, so that leads to my last question, which is, what is the status of PPE? We talked about that a lot in the beginning, but I've read some news stories nationally where, because of the increasing cases in other states, there's concern again about access to supplies. So are we in a good place here?
Dennis, we're in a good place, both the N95 masks as well as the procedure masks. We're not letting our guard down. We're continuing to look at all the sources for PPE and aggressively purchasing when we can.
Well, thank you for that. I know you're all over that. Okay, so that's wonderful updates. We'll obviously pick that up again on Thursday. Yes. Let's focus now on some non-COVID topics. Fred, there was a recent accreditation survey by the LCME, which is a liaison committee for medical education. They come to look at how we do medical education. And what did they find?
So, Dennis, that's the accrediting body. So they accredit the medical school to make sure all of the programs function the way they're supposed to.
Yep.
And actually, we're fully accredited.
Yes.
We did terrific. The dean, Dr. Verdile.
The best.
Of course, the best. Ellen Cosgrove.
Yes.
And Henry Pohl,
yes.
Two of his lieutenants.
Yes.
Who do a lot of the academic work for the college. Shout out to both of them. Really a terrific evaluation. We did well.
Big book, lots of standards, and we did so well, I think, that they said they don't have to come back till 2025.
That's right.
So that's great news. So congratulations to Drs. Verdile and Cosgrove and Pohl. Fred, we changed how we deliver care on this campus in COVID-19, and some of the things we did are now going to be durable. And one of those things is telemedicine. We talked about telemedicine. Sometimes you think about telemedicine in the outpatient settings, but there is another role for it, for example, in the emergency department. And we think now we have an opportunity going forward to do something with telemedicine that's different in the emergency department.
That's right, Dennis. So it's telepsychiatry. So as part of COVID, we stopped seeing a lot of patients in the psych clinic, and we actually did telepsychiatry and found actually that worked really well.
It did.
Actually, the no-show rate dropped considerably.
Right.
Much easier to interact with patients that way. We also did some remote psychiatry consultative work in the hospital. Same sort of thing, being able to see the patient on an iPad worked really well. And we did that because one of our senior psychiatrists was a vulnerable individual. So the emergency department is another area where we think this is going to work. So we actually signed a contract last week with a company called Insight to provide essentially 24/7 remote psychiatric services to evaluate patients who come in with mental health problems to the ED and help us decide how to triage them. Do they need inpatient services? Can they function on the outpatient side? Adjustment in their medications, whatever that might be. So we think this is going to be a really good service in the emergency department and help patients that come up to that area with mental health issues.
That's great. So we look forward to rolling that out. It'll take a little while to get the software running and the workflow figured out, but that's going to be a great thing, and I'm sure we'll do that in other areas as well going forward.
I'm sure we will as well.
But we look forward to that. Finally, Fred, we have a new chair in the hospital. The chairs obviously are physicians who run the various departments, and we gave a final salute once to Dr. Kiley, who is hopefully watching us from Arizona with Babs. But we do have a new chair of OBGYN, and we welcome her.
Yes, it's Dr. Rebecca Rogers. She joins us from Dell Medical School in Texas, in Austin, Texas.
Yes.
She's a urogynecologist.
Yes.
And I think, Dennis, she's getting ready to do her first case. She's been here, I think, just 2 weeks.
Yes. So we certainly welcome her. She's another great addition to the faculty here and going to lead a very important department for us. And so we welcome Dr. Rogers here as well.
Yes.
Very good. All right, that's it. We'll be back again on Thursday. I know we have a couple really fun things to talk about on Thursday.
Yeah, absolutely.
And we'll be back then. As always, we ask that you please take care of yourself, take care of each other, and we'll see you Thursday.